Good evening, my name is Muhtasrel, and now I would like to begin my oral presentation. The theme is congenital muscular dystrophy, and I will shorten it to CMD. So the CMD is muscle disease, which is first signed during pregnancy in the mother wombs. How it is signed is that the babies have often very few movements in their mother's womb, and after delivering the baby, so they are having kyphosis, which is round back, scoliosis, torticollis, and they are having some dislocation with the joints as in hip or knee or elbows. In difficult types of this disease, can children or babies be affected by some problems with feeding or breathing. So it's important to have support during their feeding or night time. Today, researchers had find out nearby 30 types of CMDs, which the most common CMDs is Ulrich's congenital muscular dystrophy. Then there is Duchenne's congenital muscular dystrophy, and Duchenne's muscular disease or muscular dystrophies is most serious because children or babies are affected by muscular diseases in the early age of 2 or 3, and they have no ability to learn to go or crawl, and mostly of these affected children have no possibility to live adult life. So this was the second most common muscular dystrophies type, and the third one is with laminin alpha 2, which is also important and serious case of CMD. CMD, it can be affected to everyone, to everywhere. Some cases can have a mild form, and some cases have, unfortunately, very difficult, very serious forms. And in this case, they need too many supports, too many help from society, from specialists, and from their parents to have some physical as psychical care. What is important to know that CMD is diagnosed by blood tests, by muscle biopsy test, or by DNA test, and the important test which gives 100% or 98% of the result is muscle biopsy and DNA test. Their genetic engineerings can find out which gene was mutation, which gene was defected, and fixed diagnose to the patients. In most cases, patients don't have ability to learn to go, to crawl, but in the types of Ulrich's congenital muscular dystrophy, the body is affected by muscle weakness, but the brain is as normal as anyone others. So it's also like lucky in the very very bad mood. So, but it's very much to talk about these diseases, and unfortunately I have no more time to have share my opinions. So thank you for seeing me.